Laser peripheral iridotomy. So your physician may indicate that you require a procedure called a laser peripheral iridotomy. And this is basically when we cut a hole in the iris to allow the fluid to escape from behind the iris to the front. So the reason this procedure is normally done is the fluid that's produced in the eye is produced back here in an area called the ciliary body. It flows out of the ciliary body through the pupil, it circulates in the anterior chamber, and then it drains out for 360 degrees to this sort of filter material called the trabecular meshwork into these canals called the canal of Schlemm, and then ultimately into the bloodstream. And to get to this filter material, the trabecular meshwork, the fluid has to get in between the iris and the cornea, okay? The iris is the colored part of the eye. Sometimes that forms an angle between the cornea and the iris. Sometimes that angle is narrow, or most commonly, the iris may be bowed forward, or it may be in more of a plateau configuration. Any of these creates a relatively narrow angle between the iris and the cornea. And the reason that's important is when the pupil dilates, this muscle, which is the iris, all that muscles can do is get thicker. So when the pupil dilates, this muscle is getting thicker, and that can cause the iris to plug up the drainage through the trabecular meshwork, and thus the drainage of fluid out of the eye. And as that process begins, the pupil, or rather the iris, will frequently contact the lens in the eye, creating a ball valve effect, and then the fluid that's produced keeps pushing the iris further and further into the angle, creating significant pressures. The purpose of cutting a hole with a laser in the iris is to provide an escape route for the fluid so that the ball valve effect will not create this feedback loop that makes the angle closure worse over time. Some patients will go into intermittent angle closure, where for a few periods of time during the day or throughout the week, their pressures may spike intermittently, and that also can put pressure on the optic nerve and cause a type of glaucoma. So laser peripheral iridotomies are used to reduce the risk of angle closure or intermittent angle closure glaucoma. And the procedure itself is relatively quick. It usually takes 5 minutes or so in the office. Like any procedure in medicine, it's not risk-free or pain-free. The risks of the procedure include bleeding in the eye, inflammation, cataract formation, and of course the discomfort. The procedure itself feels kind of like an electric shock. I've actually had this procedure done on myself for a different reason, and it's a bit like, say, you walk across the carpet in your wool socks and you touch a doorknob or something. It's a very brief, very electric kind of sensation. And generally we will place people on topical steroid drops after the procedure in order to minimize the inflammation in the eye and minimize scarring, because these iridotomies can sometimes scar over, and then a repeat procedure may be required. I hope that helps with your understanding of laser peripheral iridotomy for angle closure glaucoma.